Good afternoon, all. So, I am Dr. Shatanik Bhattacharya, 2015 batch, presently third year PGT Dermatology, Medical College, Kolkata. So, today my presentation is on a cross-sectional study, cross-sectional clinico-etiological study on annular skin eruptions at Medical College, Kolkata. So annular lesions are coming from the word annulus, which in Latin means ring. Lesions are oval to circular macules, papules or plaques with erythematous periphery and central clearing. Common causes are dermatophytosis, granuloma annulare, psoriasis, porokeratosis, vesiculobullous dermatosis, sarcoidosis, secondary syphilis, leprosy. Then we have annular erythemas. Then we have certain cutaneous malignancies. Then we have drug eruptions in the form of fixed drug eruption and erythema multiforme. Now, materials and methods. Aims and objectives. The aim of the study is to find out the etiology of the eruption, to study about the clinical features of the clinical entities, and to correlate the clinical and the laboratory parameters with the serological, mycological and histopathological features. Now coming to materials and methods, it was an institution-based descriptive cross-sectional clinico-etiological study carried out in Medical College, Kolkata over the duration of 1 year, which included recruitment of patients in the study, data analysis and review of literature. So all the outdoor patients were included. So the sample size was calculated using the open source statistics for public health and a confidence limit of 95%. Sample size came out to be 384. Consecutive sampling from all the patients in the outpatient setting of dermatology OPD at the medical college. I included all patients of all ages and both sex presenting with annular eruptions to the dermatology OPD. Parameters studied, socio-demographic parameters, then the symptomatology and also description of the lesion, that is number, size, shape, site, color. Important investigations were done and study tools included in the study. And the history was taken, complete clinical examination was done, Microsoft Excel was used for analysis and SSPS 24 was used for the statistical analysis. So, as per the annular eruptions are concerned, dermatophyte infections were the most common and erythema annularis centrifugum were least common. 30 to 45 years included the most of the patients. Females outnumbered males in the study. Most of the lesions resolved within 6 months. Most of them were solitary episodes, solitary lesion, asymmetrical distribution, mostly were scaly lesions. They were erythematous, induration was absent in most of the lesions, sensation was normal in most of the lesions. Most patients showed no nerve thickening, no significant history of exposure to pet animals. Most had over-the-counter history of topical application, and most of the males were office workers, most of the females were homemakers. Itching was the most common symptom, followed by burning and erythema. Significant number of patients were also asymptomatic. This is a bar diagram showing the different final diagnosis rates. 72% were due to dermatophytosis. And now the laboratory investigations, 10% KOH mount was done for dermatophytosis, VDRL with titer and HIV testing for all syphilis patients presenting with annular lesions, IgM anti-HCV for lichen planus patients, then anti-nuclear antibody in Hep2 cell line was done for lupus erythematosus, biopsy was done for confirmation. These are certain clinical pictures showing the annular lesions in dermatology OPD that came to our OPD. These are all our OPD patients. In my conclusion, majority of the annular lesions were dermatophytosis. Itching was the main presenting complaint. So the presentation of itchy annular lesions made dermatophytosis the first differential diagnosis. KOH mount, however, will not yield fungus due to application of over-the-counter topical therapy. Annular eruptions form the bulk of clinical dermatology. A good clinical eye and appropriate investigations shall help in quick diagnosis and appropriate institution of therapy. Thank you, and I thank the Medical College Ex-Student Association for this opportunity, and Moshumi Nandi Madam for guiding me in this project. Thank you so much.